We all love really interesting topics, right? We love to learn about something that kind of intrigues us. Well, there has been a certain topic in the past that we have covered a few times, and it never fails. Someone always comments on this topic. It gets the most attention for sure. Any guesses? Six, seven? No? I'm a pediatric dental hygienist, so I'm always up and hip with the kid lingo. Drum roll, please. Tongues. Hey, Verse TV. My name is Kelly. I'm a registered dental hygienist and a proud Verse ambassador. We were looking at our videos and the comments. We noticed a pattern. Tongue topics kind of blow up a little bit. So today I'm going to share some of the tongue content. Tongue content. That is hard to say. Say that 5 times. Tongue content, tongue content, tongue content, tongue content. Our past tongue content with you guys and see if there's anything you kind of want to learn more about. Go a little bit deeper. Let's get into it. Check the description of this video and we'll make sure to put the links down below to make it an easy reference for you. The first tongue topic that we're going to cover is tongue scraping. Did you know that you're supposed to scrape your tongue? Add it into your oral hygiene routine. There are billions of bacteria that can grow and harbor on your tongue, which is sometimes you can see it become a different color if bacteria keeps adding up. This is why it's great to scrape your tongue and get off all of the slough. The slough you will see on your first tongue scrape, believe me. The more you scrape your tongue, the better your breath may be. I say may because there are a lot of contributing factors to bad breath, but that can be one of the factors. When you tongue scrape, there is a correct way to scrape your tongue. Start at the base, which is the back of your tongue, and go all the way to the tip. Rinse, repeat. Don't scrub back and forth with your tongue scraper, or else you're just going to be spreading the bacteria around. The next topic is tongue ties. When you think of tongue tie, you usually think of infant or a baby. If the mother has a hard time breastfeeding or the baby is very gassy, they're kind of clicky when they're nursing, this is a sign your infant may have a tongue tie. As a mom, you may notice that it's kind of uncomfortable when they latch. This is also a sign they may have a tongue tie. There are 4 specific classes, kind of the severity of the tongue tie. As we get older, maybe you might have a hard time moving your tongue and creating certain noises with speech. So that can be corrected too to help you speak better or even swallowing. You may notice that your child or yourself may have a harder time swallowing. Could deep dive so long into tongue ties. It's amazing how a tongue release or a tongue revision can help improve your whole entire systemic health. Even sleep, and sleep is so important. Another topic about the tongue. Burning your tongue. When you eat something or drink something really hot and you burn your tongue, it is the absolute worst sensation. And then later, after a few minutes or even a few hours or a day, you might notice that your tongue still hurts when you eat or drink something. We have tiny papilla and taste buds on our tongue. This is what helps us taste. This can slough off the top part of your tongue. Your mouth heals really quickly. It's a beautiful thing. It's like our body knows that we need our mouth every single day to talk and to eat and to move our tongue around for speech. Another topic is scalloped tongue. This is the tiny ripples on the side of your tongue. I personally have a scalloped tongue. Let me see if I can show you. It's not as prominent right now, but usually like in the morning time, and I think it's because I'm not resting my tongue on the roof of the mouth. Your tongue should naturally rest at the top of your palate like this. That's where your tongue should rest. And I feel like my tongue rests more on my lower teeth, which creates that ripple effect. But there's lots of other reasons. It could be a vitamin deficiency, thyroid disorder, Down syndrome. Again, we could go on a whole nother topic about scalloped tongue. Now let's talk about black hairy tongue. This is a topic where most people think there's hair in my mouth. That's really disgusting. But the hair is actually papilla. And this is all over our tongue. It just kind of appears and it looks like hair. Black hairy tongue is usually caused because there's an overgrowth of some bacteria in your mouth and it causes the tongue to appear black. Sometimes it's also because the yeast has overgrown in your mouth. Over time, the accumulation of food and dead skin cells can build up on your tongue, making your tongue appear hairy and black. Sometimes antibiotics or certain medications can cause this. Also, if you smoke, this can cause the black appearance as well. Black hairy tongue is usually harmless and it will recover in a few weeks. Have you been surprised? I have been talking about these many tongue topics. Like, how is there this many tongue topics to talk about? But again, I will keep going. Tongue positioning. Yes, there's a specific way you're supposed to have your tongue in your mouth. I was kind of talking about it earlier, but we're supposed to have it resting on the top of our palate. If it's not, and you're a mouth breather and you have your mouth open a lot and your tongue isn't really in any position, you can actually do exercises to help with this and strengthen your muscles so you can get the correct placement of your tongue. Specifically, you could see a myofunctional therapist. They specialize in the tongue and the muscles in the face. Another topic, did you know that you could get a Charlie horse in your tongue? Ask my friend Charlotte about it. Yeah, you can get a Charlie horse in your tongue. Kind of starts towards the back of the tongue, I heard. And when it happens, you can't really talk and you don't really know what's going on because you have a Charlie horse in your tongue. Kind of like when you get a Charlie horse in your calf, you can't move. It would be a crazy sensation. Again, it's never happened to me. I hope it never happens to me. I feel like that would be so uncomfortable. Finally, Ozempic tongue. Yeah. So Ozempic is used for a diabetic medication or for weight loss. And people have kind of been noticing people who are on that Ozempic medication, their tongues kind of burn. They kind of look like they have geographic tongue. As we get these meds, we kind of notice a pattern with people that use it. And this is something that we're starting to see in the dental office. So after all of that glorious tongue talk, comment down below what you want to talk about, what you find most intriguing, and we can kind of elaborate on it. And don't forget to come back every Thursday to a brand new video. Bye, guys.